Hello, Arsene. This is Jennifer Adler from University Medical Center Hamburg-Eppendorf, and I'm very honored to present to you our study on sex-specific effects of obesity on cardiac structure and function. So the aim of this study was to investigate the association between general obesity according to BMI and abdominal obesity according to the waist-to-hip ratio, with changes in cardiac structure and function, as well as to investigate if there are sex-specific differences regarding the association between obesity and cardiac remodeling. So obesity is a very important cardiovascular risk factor, is about to replace smoking in terms of cost and healthcare consequences. We know that males are more prone to suffer from obesity and that abdominal obesity is associated with more severe adverse cardiovascular events than general obesity. However, what we don't know is if there is a specific pattern of remodeling which is different for abdominal and general obesity, and if there are sex-specific differences regarding this remodeling pattern. So we investigated 2,244 healthy subjects aged 46 to 78 who received cardiac magnetic resonance imaging as part of the German population-based Hamburg City Health Study. And after adjusting for other cardiovascular risk factors, an increase in BMI was independently associated with an increase or with a greater left ventricular and diastolic mass and increased volumes. So in simple terms, an increase in BMI is associated with a larger heart. On the other hand, an increase in waist-to-hip ratio was associated with a proportionally larger increase in left ventricular mass than an increase in BMI at the expense of lower volumes, indicating concentric remodeling. So cardiac hypertrophy, the muscle thickens, but the volumes don't increase proportionally. And this association was interestingly more prominent in males than in females regarding the right ventricle. Also, only in males, both BMI and waist-to-hip ratio were associated with a slight prolongation in T1 relaxation times, potentially indicating myocardial diffuse fibrosis. So this study shows that abdominal obesity is actually associated with a more dangerous remodeling pattern, concentric remodeling, in comparison to general obesity. And this indicates that GPs and patients should pay attention to their waist-to-hip ratio or the waist-to-hip ratio of the patients and should treat visceral obesity potentially more aggressively than general obesity. Also, we as radiologists need to think of abdominal obesity as a potential cause when we see this type of remodeling in our cardiac magnetic resonance exams. Thank you very much.